Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Going to be speaking with Kasey Frey, second-year Arcadia University Doctor of Physical Therapy student. She's joining us on the program to talk about the new student-run physical therapy pro bono clinic there at Arcadia, which opened on March the 18th, as a matter of fact. Now, the goal of the Glenside, Pennsylvania clinic is to help address healthcare disparities by providing free physical therapy services while giving students hands-on learning opportunities. Welcome to Health Professional Radio, Kasey Frey. Thanks for taking the time.
Yeah, thank you so much for having me. I'm so happy to be here and have the opportunity to talk about our new physical therapy clinic and just get the good word out about the services that we're able to provide to those in need.
Was physical therapy your first love when you decided to go into medicine?
Honestly, yes. I knew that I wanted to be a physical therapist since I was probably a freshman in high school, just growing up playing sports and being active and wanting to promote activity and physical wellness in those around me. That was always something I was interested in.
Were you athletic, or did you tend to want to help the athletes with their problems?
Both. I was athletic myself, playing sports my whole life growing up, and then into high school and even into college as well. And when your teammates, when your friends are hurt, you feel that yourself and you want to do what you can to help them. And that's what physical therapists do.
Healthcare disparities. We've been hearing so much about healthcare disparities. I mean, we heard about it before the pandemic. What are some of the disparities that you find when it comes to physical therapy? We keep hearing about cancer and early detection of this disease, that disease, or the other, but we're not hearing a lot about disparities in physical therapy. Explain it to us.
Yeah, I think you started getting at the biggest one yourself, which is the lack of education, the lack of understanding. A lot of people out there don't know enough about physical therapy and don't know what we can do to help them. And even like you were saying in cancer, like most people wouldn't think that physical therapy can help cancer. So I think education for sure is one of the biggest disparities out there, and just what we can do.
As a physical therapy student, when it comes to having patients referred, is this something that physicians do regularly? Is it like a go-to thing? Well, let's try physical therapy first or maybe second. Or do you find that people tend to look at physical therapy way down the line?
I think that's probably split pretty evenly. I do think physicians are now beginning to refer to physical therapy early, and especially with like opioids and all of that, we're starting, as a healthcare professional community, we're starting to realize that opioids are not the answer, and we should be referring to physical therapy first, and then after a failed course of physical therapy, then we move on to surgery or to a higher level of pain management. So I think that it probably goes both ways, where potential patients out there are excited to try physical therapy first, or maybe they just don't know enough about physical therapy. Their doctor writes them a referral for it, and they kind of just sit on it and don't pursue receiving care.
Is physical therapy something that is forefront when it comes to training physicians that aren't physical therapists? Is it something to say, hey, these are people who are standing by waiting, go ahead and refer? Is that something that, because I understand that nutrition isn't focused on not a lot in medical training, yet it is one of the mainstays of life.
Right.
Or the mainstay.
I can't say that I'm entirely sure about like medical and physician training, but I do know that Arcadia has a physician's assistant program where students of PA are on Arcadia's campus and learning and studying to become physician's assistants. And at Arcadia, we do a lot of interprofessional activities and they're like day-long educational projects that we work on together, physician students and DPT students. Physician's assistant students and DPT students. And where we kind of tell each other about our profession, and we learn about ways that we can work together in order to best serve our potential and future patients. So I do think that we're working towards getting the allied health professions to understand each other better and to work better as a team, of course, always in the best interest of the patients.
pro bono physical therapy. When I hear pro bono, the first thing I think of is lawyers. Or are you seeing more people becoming interested in physical therapy because of the pro bono work, or because of simply the availability of physical therapy without having to be referred?
It's probably both. Yeah, I definitely think it's both. The fact that the care is free and the fact that it's easier to access and that patients don't have to go to their primary care physician first in order to get a referral to see us. So I think both of those things definitely play a role in the volume of patients that we're seeing. And that's a great thing, whether it's increasing access or decreasing cost, whatever we can do to make our services more available to our patients. That's what our goal is to do.
As a student, I'm sure that there's a wealth of knowledge gained from people who are coming to you, maybe with symptoms or problems that they're communicating to you, as opposed to those problems being communicated to you via referral. So I guess you have no preconceived notion about what's going to happen as the door opens.
Yeah, and that's definitely something that students have to learn to, like you said, have to just learn to work with. And it can be a good thing or a bad thing, because sometimes it's common in physical therapy to receive a referral that says evaluate and treat. So then we're almost in a similar situation where the only thing we have to go off of for our patient exam is the patient's chief complaint. Mm-hmm. So it's almost good practice that we're not having referrals, because that is such a common thing in the world of physical therapy. And then at the same time, when it comes to physical therapy, we're taught over and over again that not to lay all you have on the diagnosis, because a lot of times the patient's chief complaint may not directly align with the diagnosis. Mm-hmm. And we want to do, in physical therapy, we spend a lot of time treating the symptoms and the complaints rather than the actual diagnosis itself. Like, there's nothing we can do to cure arthritis, mm-hmm. but we spend a lot of time decreasing the pain and decreasing the limitations that are associated with arthritis. So in that case, we're really going off of the patient's chief complaint anyways, rather than the medical diagnosis. So it's good practice for students to not have a referral sometimes.
Let's talk about the student-driven aspect of this project. How much is faculty involved? Are they just simply agreeing and saying, hey, this is a good thing, do what you do? Or do they have their hands in it in a significant way?
So in terms of the clinic being student-run, we have a student board of 19 students, and we have one faculty advisor who really allows us to do the most we can do. She wants us to get the valuable experience of opening the clinic, running the clinic, and then she'll only step in when we absolutely need her. And then in terms of the SPTs, the students from the curriculum who are rotating through the clinic and serving in the role as SPT, we have 2 core clinic mentors who are in there almost every night that we're open. They're not hands-on with the treatment of the patient because they want to give students that experience, but they are very hands-on with the planning of the plan of care and the reviewing of the documentation and really giving valuable feedback to the student in order to then provide that valuable clinical experience so the student can always be learning and always be experiencing new things.
Kasey, give us a website where we can learn much more about Arcadia University and the program that we've been talking about today.
Yeah, so you can just go to www.arcadia.edu, and you will be able to navigate the website to find the physical therapy program and the pro bono clinic.
Thank you, Kasey. It's been a pleasure speaking with you this morning. Thank you so much for your time.
Thank you so much. Have a good one. Bye.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Kasey Frey, second-year Arcadia University Doctor of Physical Therapy student. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.